The dangers of high blood pressure. I don't want this video to be long, but I will try and explain quickly what high blood pressure is. High blood pressure luxinzelelo lwegazi. It is when the pressure in your blood is higher than normal, in such a way that it is putting pressure on the artery walls and in the heart. Remember, the heart is the one that pumps blood. So when you have high blood pressure, your heart is in trouble, because it is the main organ that pumps this blood that is in a high pressure. I almost always make an example of a hose pipe. When you put it in the tap and you open the water, the more you open that tap, the more the pressure of that water that goes through that pipe. That is pressure. There are times when you open that tap too much and you've been using that hose pipe too much, it bulges. It has points where in the hose pipe it will bulge. That is actually called like an aneurysm in terms of blood vessels. Okay, so that is blood pressure. High blood pressure puts a lot of pressure, or it causes a lot of damage in a lot of organs in the body. Your brain, your eyes, your heart, your kidneys. Okay, but now I'm going to start with the risk factors. And don't think you are too young. No one is too young. The minute you get to your 20s, try to at least check your blood pressure at least once a year. There are many retail pharmacies that have nurses, that have a clinic where you can do your blood pressure. The annual wellness screenings are very important in the prevention of diseases. So I'm going to first start with the risk factors. I'm actually going to read them from this book, Primary Clinical Care Manual. Okay, this book is by Soweto Trust. This is the 10th edition. Okay, so I just want to read to you the risk factors. One of the risk factors, a risk factor. What is a risk factor? A risk factor is a thing that if you have it, it puts you at risk of having another. Or it's a behavior that if you are doing it, it puts you at risk of getting that. Yeah. So the first one is diabetes. If you have diabetes, you are at risk of getting high blood pressure. If you are smoking affects your arteries. Smoking affects your blood vessels. So it puts you at risk of high blood pressure. Central obesity umkhaba. Belly fat puts you at risk of high blood pressure. I did do a video on umkhaba, on belly fat. I'm still going to upload it. Dyslipidemia, high cholesterol. If you have high cholesterol, you are at risk of having high blood pressure. Physical inactivity. If ungumntu onga exercise, if you are someone who does not exercise does not mean running, people. It means even just walking around the block. Just take a walk, leave your phone behind, take a walk around the block. That is physical activity. Okay, so physical inactivity puts you at risk. You need to count how many risk factors apply to you, ne? And then you tomorrow in the morning or any day after, you go and you get your blood pressure checked. Family history, especially if in your family there are men less than 55 or women less than 65 who get high blood pressure. The last risk factor is age, especially for men more than the age of 55 and women more than the age of 65. But I want to tell you one thing. This thing of age, I had a patient today. She's less than 35 years. She is on treatment for high blood pressure. Okay? But in her case, it's mainly stress. Okay? That's why it's important to manage stress. So what are the dangers? The first one is a heart attack. Because your heart is working too hard, the chambers of the heart are going to get exhausted. And then you might get a heart attack. The second one is stroke. In your brain, there might be a blood vessel that might rupture, or there might be a blockage. Okay? I think the blockage is caused by atherosclerosis. I am not sure. Yeah, but there will be a build-up. It's either it's a clot or it's a lipid that builds up, and it will cause a stroke. The second one is an aneurysm. An aneurysm is the one that I explained when I was making the example of a hose pipe. Part of the vein may get weak, and then you might get a bulging. And then at some point that bulge can burst open and you have an aneurysm. Sometimes you can hear people say that, oh, they said I have a brain aneurysm. The next one is heart failure. Okay? Your heart will stop working well. It's going to get tired, guys. That's why it's important to prevent these things. Just get screened. If there's a nurse nearby you, ask her to screen you at least once a year. Or go to your nearest clinic. Or, for instance, I do wellness screenings, but obviously I am in Cape Town. If I'm in Cape Town, you can WhatsApp me, 076 773 2052. You can WhatsApp me. I will come to where you are. The travel fee is 100 rands. I will come to where you are. I will do your blood pressure, your sugar, your cholesterol, your weight, your urine test. The next one is kidney problems. Because the high blood pressure affects the blood vessels, it can cause them to thicken or to become narrow. Then it can cause kidney damage. That can lead to kidney failure. People, these things, they happen to people. Like, sometimes they can happen in their 40s or in their 50s. And we don't put together the dots. This is something that you could have prevented a long time ago. If only you lost this weight. If only you lost umkhaba. If only you started exercising. If only you stopped smoking. You wouldn't be having this problem now at age 55. If you started when you were 20, or when you were 30, or when you were 40. The next one is eye problems. It's the same reason. The blood vessels become thickened, they become narrow, and they become torn. Sometimes they rupture, and they can cause that. I see it a lot in people who have uncontrolled or poorly controlled blood pressure. They like to get a rupture of veins in their eyes. You'll find that the eye is red, blood red. It's blood. It has literally, the vein has bled. Then you know that person likely has poorly controlled high blood pressure. If it will happen to the eye, don't you think it's going to happen to your brain? The next one is metabolic syndrome. Metabolic syndrome, a syndrome is a collection of things, of diseases. Okay? It's a collection of things. So this one is a metabolic syndrome. It can be caused by increased waist size. That's central obesity, umkhaba, belly fat. Belly fat is not healthy, mense. Belly fat is not healthy. Work on it. It doesn't mean stop your life and go to exercise every day. Stop eating meat, stop everything, eat lettuce every day. No, just work on it. Start one step at a time. Just start working on it. Look, watch what you eat. Stop this fast food and processed food. Metabolic syndrome can also be caused by increased cholesterol, ne? High cholesterol. Especially if you don't exercise, you will have a problem with cholesterol. When you get to your 30s, 40s, 50s, especially 40s, 30s, late 30s, you will have a problem with your cholesterol because the good cholesterol is increased by exercise. The bad cholesterol is decreased by exercise. Some people will have changes in their memory or in their understanding. Memory, poor memory. Even their understanding is poor of things. You understand? That is serious. The last one is dementia. There's something called vascular dementia. Sometimes it can be caused by a stroke. But dementia it's another topic for another day. So that's basically, those are the risks. Those are the risk factors of high blood pressure. The risk factors, it's also the dangers now of hypertension. Because I feel now, we know enough. We know there's high blood pressure. No, it doesn't start there, guys. It starts with us. It starts with us. Yes, you can have a family history of high blood pressure, but it starts with you. It starts with you. What did you do in your early ages when you were younger? What were you doing? What were you eating? Were you physically active? Were you exercising? I know people abadala who have passed on at the age of, umadala, he was 80. He actually died of a prostate problem. He had no high blood pressure. He had no diabetes, no high cholesterol, nothing. Tamkhulu. Ayengekho kwipilisi. Tamkhulu okwalanga. Ayengekho kwipilisi. Wayenomzimba ongaka. Umzimba omlingeneyo. Umzimba omngaka. It's a secret, get that thing of uba nomzimba ongaka. And then ubaleke ne-stress. Guys, stress is, stress, I must also do a video on stress. It's actually another risk factor I did not mention. I did not mention it there. Stress is a risk factor for high blood pressure. Some people have high blood pressure only because of stress. They stress a lot. Yekani stress bithuna. Into uba ujongene nayo ifuna uhoywa ngoku ihoye. Uba uthi xa ujaja ufumanisa into yoba le ndingayenza man an hour later okanye kusasa, yislote for ngomso later, for an hour later okusasa. Uba le ithi okay isolution yayo mhlambi nge-month end, yislote nge-month end, then stop worrying about it. You need to know how to handle stress, because in life, guys, there is stress, especially when you become an adult. Awufika pha ko 20s, late 20s, unyuke uye ko 30s, wa adulta ke ngoku. So I will make a video on stress, because it affects many things in your body. It affects many things in your body. Like you can have mental health problems because of stress. But we're not talking about mental health problems now. We are talking about the dangers of high blood pressure. For those of you who are in Cape Town, WhatsApp me. I'll come and I'll do your wellness screening. Everyone must do a wellness screening once a year. If you are on treatment for anything, maybe high blood pressure, at least do your blood pressure once a month. If you are diabetic, at least do your blood pressure once a month. If you are on oral anti-diabetics. But if you are on insulin, no, you have to do at least twice a day, okay? If you're on insulin, you are actually supposed to have your own meter. If you have high cholesterol, at least every 3 months. when you start treatment. But after that, if it's controlled, once a year. Especially if you have family history of these diseases. Do your wellness screenings. All right, ladies and gentlemen, until next time.